So with that, it is now my greatest honor, to introduce our nation's 67th Secretary of State, our former First Lady, and a champion of our community, Secretary Hillary Clinton.
Oh, thank you so much. And let me start by thanking the mayor and the city council, and thank you, council member, for being here. It's thrilling to have this recognition, not for us personally or institutionally, but for this cause and this mission that we are all here to support. I could not be happier that I've had a chance today to see firsthand what is happening here at the Foundation for Recovery. I just saw a room packed with volunteers who are putting together the recovery kits. And now I'm here with so many people in this room who make this important work of the foundation possible. Sean, thank you for your leadership. Thank you for your commitment, your passion. It is so obvious to all of us. And you're creating an incredible positive impact for so many people here in this state. I also want to recognize your husband, Ryan Hampton, 2 months married. And Ryan is from Mobilize Recovery, and he's worked to support people to find pathways to recovery for many years. In fact, Ryan worked at the White House when Bill was president. So we have a long connection with him, and he has shared his own personal story of recovery with us, and then through the Voices Project, elevating those voices of others. Chris Thrasher, who is the CEO of the Overdose Response Network of the Clinton Foundation, has been himself in recovery for 33 years and is leading our efforts to connect the Clinton Foundation with people across the country who have that lived experience and are we think, best people to reach out and help others. So thank you, Chris, for being here. And you'll hear in a few minutes from a wonderful friend, ally, and supporter of our work at the Clinton Foundation, Joe Kiani, the CEO of Massimo, which invents health-related devices that save lives. And he turned his attention to what he could do with his company to help those who suffer from overdoses, who are in recovery, be successful. And you'll hear about that, which is very exciting. And I want to thank everyone with Direct Relief, the National Association of Recovery Residences, and all of the community organizations who are represented here, because you're the true leaders in this ongoing effort. I want to give you two numbers. 109,680 and 5. So 109,680 is the just reported number of fatal overdose deaths last year across our country. 5 is the number of young people that Bill and I personally know who've lost their own lives to overdoses. Really, it was the number 5 that got us so motivated to be able to figure out ways to help because of the loss of those young people. One of whom was interning at the State Department when I was Secretary of State and attending law school at the same time. Social use, out with friends for dinner and drinks, needed to stay up to study, took a pill that somebody gave him, never woke up. Another is the young man who lived across the street from us in the town that we live in New York. Same story, same tragic outcome. Another, a young woman, daughter of a dear friend of ours, same story. On it goes. So the people in this room know better than anyone that overdose deaths have such a devastating impact. And I'm really happy that two of Bill's and my dearest friends, Brian and Myra Greenspun, can be with us because of their commitment to supporting community and volunteer efforts here in Clark County particularly. So overdoses are currently, remember the 109,680 number, the leading cause of death of 18 to 45-year-olds, people in the prime of their lives, just starting out, starting work, starting school, starting a family, doing, what we all imagine you do in those key years. And it's a tragedy for every single person. And it has to be addressed, and it has to be addressed effectively. And that's been our mission since we began. And since, as you heard from Sean, 2019, the Clinton Foundation has distributed 20,000 doses here and 726,458 doses to 23 recovery organizations around our country, as well as residences and public health departments in 20 states. There is reason for hope, and that's what we're in the business of, because a recent study found that 3 in 4 people who struggle with addiction do eventually recover. People like Chris, people like Sean, people like Ryan, people like some of you. But they can't recover if we ignore them, dismiss them, marginalize, mistreat them, deny resources for them, think prison is the answer instead of recovery is the answer. And so we've got work to do to make sure we get life-saving naloxone, otherwise known as Narcan, to those who need it, as well as to destigmatize addiction and mental health struggles, and to support organizations like this, which have a tremendous track record. Since 2005, the Clinton Global Initiative, which is a program of the Clinton Foundation, has been building partnerships with community groups, with businesses, with civil society, with governments at all levels, to create what are called commitments to action that will make a difference in people's lives. And that is where this network, our overdose response network, really came out, because we bring together people who have different experiences, different expertise, different resources, and put them all together to actually make a difference that one of us alone could not. And that has been extraordinarily important and successful over the last 15 years. And in particular, a decision that Bill made that was instrumental some years back was to persuade the maker of Narcan to make it in a nasal spray delivery system. We still give out a lot of injectables because those are tried and true, and if you teach people how to use it and they feel comfortable, they are absolutely essential. But we also knew that in some cases that was not possible, and the nasal spray was more likely to be administered more quickly, more effectively, with the result that we were looking for. So when Bill called some years back the director of this company and said, "Can you do this?" The answer was, "Let's try." And indeed, thankfully, that has been a very positive outcome. Now, we also bring faith leaders together because we know that, as Sean was saying as he was walking us around, there are many different paths to recovery, both to begin and to maintain recovery. And people who are seeking treatment for mental health issues and addiction are still more likely to contact a member of the clergy than a physician. So we want to meet people where they are, wherever that is. And so we've done a lot of outreach, and Chris Thrasher has led this for us, in educating clergy members, in working with them, in helping churches and synagogues and temples and other places to have a stock of naloxone, because you never know when someone might walk in that door seeking help. And so we've been putting kits together and working to end the stigma of addiction to help people who choose a faith-based journey for their recovery. This is all about working together. It is all about separating us from the differences that divide us and finding common ground, because when we work together, guess what? We get really great things done. And I'm thrilled that you are here in an example of what is possible. And I want to call up two survivors of overdose, because I think we want to hear directly from people who are affected. Rob and Danica, and I just had a chance to meet with them, and I'm delighted that they are willing to share their story with all of us. Thank you.
Good morning, and thank you for your impactful words and the work you're doing and the work everybody in this room is doing. We met in the room earlier and we were talking, and the doctor said to me when he walked up, he said, "How long have you been free?" And that impacted me. You know what I mean? As a person in long-term recovery, I am free today. You know what I mean? But that doesn't honor my whole journey, right? Sean and I were talking for the past 2 weeks, kind of narrowing this down and how to honor this space. And what I realized was that I hadn't thought about certain parts of my own journey before I came into recovery and how I ended up there in great detail, right? Like, I just thought about it in a general way, and we kind of honed in on this one story for me, because I'm a survivor of overdose probably 10 to 15 times at least. You know what I mean? I'd be lying if I gave you an exact number. It was that many times. And one story that I did hone in on that I really feel like does honor this space is that I was homeless for the last 5 years of my addiction. Completely lost, gone, separated from everybody in my life, completely disconnected, no hope. And one day I was in a tent under a bridge. I did a shot of heroin and I overdosed. It was a shot that I had done 1,000 times before. No big deal. And I wake up in the hospital. I don't know how I got there, but I can tell you now, having gone back, that the same people that are in the tent using with me were the ones that had the Narcan. They had Narcan because of outreach teams like Shine a Light Foundation, all these amazing organizations in our town that were handing it out to the people that were there, right? Like, I've never been Narcan by an EMT or a police officer. Doesn't mean they wouldn't do it. They're doing amazing work, right? But that's not the full picture of what's going on, right? Where they're at, where I was at, was where the Narcan was at. That's what's so important, right? And I woke up in that hospital bed, and the first time you get Narcan, they don't strap you down. I woke up, I'm afraid. I walked the 4 miles back to my tent, and I can see my tent, and I fall out again. It's a dark street, nobody's around. I was found again by another person in my community that was actively using, who had Narcan on him again. So twice in one night, my life was saved by these actions. And today I live a really amazing life. You know what I mean? I'm the outreach director for Shine a Light. I'm the programs manager at Crossroads, right? Like an active member of this community. And none of that happens without stuff like that. You know what I mean? Like, I believe this with all my heart, that God shows up seconds and inches. You know what I mean? And that's just one example. You know what I mean? I was in active addiction for 25 years. So, you know what I mean? I'm really thankful for the work that's being done here, and that I get to be a part of this community. And thank you for your words. And I'll carry that with me, and thank you for the work you do.
Good job.
Hello, my name is Danica Martinez. Thank you, Mrs. Clinton, for being here. I want to say thank you to Foundation for Recovery, as well as the Shine a Light Foundation, as well as other street outreach organizations. Because of them and because of all the work they're doing, and with all the Narcan that they pass out, I am here today. I'm able to speak to all of you. Also, I would like to thank you for giving people with lived experience, such as myself, this platform to be able to share our experience, strength, and hope. So, I was homeless for a while. About 7 years, and I was out there in the tunnels, and I'd like to share a story of that that was very impactful with me. I'm in a tunnel with some friends. I'm actively using, and next thing you know, I wake up to them using Narcan on me. I fall back out again. I wake up again. One more time, they use it on me. This Narcan was there because of the fact that we had organizations, street outreach organizations, that passed out these Narcans to us. If they had not been there that day, that was not given that day, then I would not be here today. And now today, I am over a year clean and sober.
All right. Thank you very much.
I work for Nevada Homeless Alliance. I am the PLE coordinator as well as a resource specialist, and I'm also a LiveDex consultant. And thank you very much.
Wow, I'm so grateful to both of you for being willing to come and, as you say, share that space and tell those stories. Now it's a great pleasure to introduce Joe Chiani, the CEO of Massimo, who has been just the most extraordinary partner to the Clinton Foundation, the Clinton Global Initiative Opioid Recovery Network, and is someone who is truly on the front lines, trying to find ways to help people who not just overdose, but prevent overdoses and then assist with recovery. Joe.
Thank you so much, Secretary Clinton. Thank you for inviting me to be with you here today. It's a great honor to get to work with you and your husband and daughter, Chelsea. Thank you all for all the work you're doing to save people's lives. You're not just saving people's lives, you are truly the glue that's keeping our civilization together by caring, by loving. And the Clinton Global Initiative, I can't think of a better organization that then glues the rest of us together and reminds us how we have to help each other. Thank you. Thank you. I started Massimo 34 years ago, and I'm an electrical engineer. I have a couple of honorary degrees of doctorate, but I'm not a doctor. I wanted to invent a way to make pulse oximeters accurate, even when people moved, because 70 to 90% of the alarms from pulse oximeters were false alarms. And I knew there were people dying in the general floors of hospital that were given opioids. But because they couldn't continuously monitor them due to the false alarms, literally they were found dead in bed. I was sharing that story with President Clinton several years ago, and he told me about some of these people that you knew that died. And literally at the kitchen table, Nemo's kitchen table, he challenged me. He said, do something for the people at home. And I did not know. I was ignorant that at the time, 50,000 plus people were dying of opioid overdose at home. And now the numbers are staggering, 100,000 plus. And I went home that night. I couldn't sleep. And I thought about it. I came up with an idea. Next morning, I got my team together, and we said, what if we built this? And what is this? This is basically taking what we had at hospitals, shrinking it down to a wearable sensor that can last for about a week if you want to wear it all day, all night, take a shower with it, whatever. And it connects to your mobile phone or a hub if you have a place to put a hub at home. And if opioid is causing opioid-induced respiratory depression, which is, by the way, why people unfortunately die of opioids. They forget to breathe while they're sleeping. And the same reason we take opioids to relieve us of a pain, it gets rid of the pain of CO2 building up when you don't breathe. That is why most of us breathe, with the CO2 pain buildup. Anyway, so we came up with this solution. We went to the FDA with it. They actually chose it as one of 8 products out of over 250 that could help the opioid epidemic. And during COVID, it actually came into use to relieve busy ICUs from COVID patients that could be monitored remotely. And it showed 70% reduction in mortality. Anyway, this technology was just approved by the FDA after several years, last month. And we are excited because it truly can help people wake up. In a couple of studies we did in Canada at the safe syringe sites, where people were going into under care, under supervision, take their drugs. Just the alarm of this device woke them up. They didn't even need Narcan. I think it's a great combination, Narcan and this. But as we were developing this and getting it out, and we're excited to work with the Clinton Global Initiative to get the word out on it, we also realized saving people's lives from opioid-induced respiratory depression is a small part of what needs to get done. What needs to get done is to help people get rid of their addiction. And I've heard people tell me this, that were addicts, that they first take opioids to get the high, then they take opioids because they can't deal with the withdrawals. The withdrawals are so painful. It makes them vomit. It's pain that's really afflicting them. So along the way, we came across a product that we did not invent, but we took it on, called Bridge. Bridge is a device you put in the back of your ear. It stimulates 3 nerves that gets rid of that withdrawal symptom within 20 minutes on 80% of the people. And recently, unfortunately, I was in a hospital for 3 weeks where I resisted opioids because I knew 1 out of 5 people who take opioids get addicted to it. But the pain got so bad that all I could imagine was the guillotine. I just wanted my head off. So I took opioids. Literally within 2 days, I became resistant to it. I went from the highest dosage every 6 hours, and I wanted every 5, every 4. I had become addicted to it. My team brought in Bridge, put it on me, and within an hour, I was myself again. I was able to go from a 15 milligram dose to 10 to 5 to none before I left the hospital. So I think the combination, hopefully, of Bridge, helping people get rid of their addiction, that want to get rid of their addiction, and hopefully opioid, we call it Halo, we can hopefully save tens of thousands of lives a year. And I'm grateful to you, Sean, to Ryan, for taking your terrible affliction, and it happens to the nicest people. That's what's bad about it, this opioid addiction, and then coming back and helping other people get rid of theirs. So thank you. We're glad to be partners with you. We're happy to donate what we can. I'd like to save 1,000 people's lives here from opioid addiction, if we can, through Bridge and Opioid Halo. And I appreciate this opportunity, Secretary Clinton. It's wonderful to be able to be a small part of what you all do. Thank you.
Thank you.
Thank you. Thank you so much.
All right. Well, thank you again, everyone, so much for coming. I mean, what an honor. What an honor to be here with Secretary Hillary Clinton and, you know, powerhouses like Joe Kiani doing incredible things in supporting our community. So I want to thank everyone for being here today. Thank you for those volunteers who showed up again, as you have for years, to continue to pack together these kits. And I hope everyone has an incredible week, and thank you so much again for your time. I think that we'll stay in the room, and we can, let's do one more round of applause for the Secretary and the Clinton Foundation. So thank you, everyone. Thank you, Secretary Clinton.
Thank you all. Thank you. And thanks to the press for covering this really, really important story. Thank you all.